Hello, everyone. I hope you're all doing well today, and I hope you're all staying safe. My name is Rohan Shah, and I'm a board member for Care for Them. And today I wanted to discuss the various symptoms and treatment methods of the COVID-19 pandemic. So, firstly, I wanted to start with the symptoms of COVID-19. So, we mentioned a lot of these symptoms in an earlier video in which Josh Kurian discussed the practice of social distancing. So, if you would like more information about these particular symptoms, you can check out that video as well on the YouTube channel. However, various symptoms may be presented that show signs of the novel coronavirus, most notably being fever or chills, cough, shortness of breath, and fatigue. This list obviously does not represent all of the effects of COVID-19, though, as the pandemic is still relatively new, and research is continuously being conducted to encounter more and more symptoms. And the CDC, as it says on the bottom, the CDC will ensure that all of this information is going to be updated throughout the research process. But now we come to the idea of either being symptomatic or asymptomatic. So if you test positive for COVID-19, you will either experience symptoms or be considered symptomatic, or you won't show any symptoms and be considered asymptomatic. However, either way, you're going to possess the virus and you're going to pose as a threat to those around you. Because something simple like a cough or a sneeze could transmit the disease to people standing around you. And it's very, very important that everyone understands that even though you may not experience symptoms, you may still possess SARS-CoV-2, which is the name of the virus. It still isn't very well understood the prevalence of asymptomatic cases, so it is a true necessity for us to all stay safe and just be aware of this idea that anyone can really have the virus at any time. So now, if you really are concerned about potentially showing symptoms or even having the coronavirus itself, there are a variety of testing options that you can utilize to see whether or not you are positive for COVID-19. For example, as you can see on the screen, the most general option is a COVID-19 drive-through testing facility, which is very efficient, and it's a free test that can be found basically anywhere in your county, in your city, in your region, and in the United States. Furthermore, there is the PCB swab test that exists where doctors can determine whether or not COVID-19 is in your system. And finally, there are the antibody blood tests and the antigen tests, which are much more advanced tests that can determine either if you are contagious with COVID-19 or if you were previously positive for the virus. So all in all, there's a variety of options that you can use to determine whether or not you may be positive for the coronavirus. And I suggest that if you ever feel like you may be experiencing various symptoms of COVID-19 or you just have a general concern, I suggest utilizing one of those various testing options for sure. So if you were to test positive for COVID-19, obviously that means that self-treatment has to result. So there are many methods of self-treatment that you have to do, and the most important one being to self-quarantine and rest at home. So a minimum of 2 weeks is required after a positive test to isolate yourself from others in order to prevent potentially spreading the virus, obviously. And furthermore, it's really important that whenever you're resting at home, and just to be clear, whenever you're resting at home, it doesn't necessarily mean you have to be lying in bed all day, it just means that you are resting and staying away from other people so that you can prevent, obviously, spreading the virus. So whenever you are at home, it means that, you have to stay hydrated. That's extremely important for your health, and it's just extremely important in general. Furthermore, if you want to prevent things such as constant headaches, taking an over-the-counter drug such as acetaminophen is very important because it can help you ease with these symptoms. And finally, it's important to make sure to stay in touch with a doctor regarding your status. And if you begin to experience more severe symptoms, such as severe loss of breath, I would suggest that you make sure to reach out to a doctor or other emergency services as soon as possible. So, is there an antiviral treatment? Well, the simple answer is no. It's unfortunate that we don't have one, but many scientists are still working diligently to try and create a vaccine. But unless many people don't understand why it takes so long to make a vaccine and get it out to the public. Well, here, I'll tell you right now. So the thing is, an antiviral drug must be able to kill a virus without killing the human cell it occupies. And also, viruses are very highly adaptive. So all of this must be taken into account when creating not only a vaccine, but an effective vaccine, and one that scientists know can get out to the public and prove to help with curing the pandemic. All in all, There's just a lot of treatment options for the coronavirus, and although it may be challenging to create an antiviral treatment, as you can see, in particular, there are other self-treatment methods we can employ to make sure we limit the spread of COVID-19 and start the journey to curing the virus. These are all the sites that I used in creating this presentation, and that concludes it. Thank you very much for listening.